discuss the ophthalmic surgical tray. Uh, so these are the different surgical instrument. I am going to define and explain one by one the name of the instrument and the uses of the instrument. So at the top of the list, we have an eye speculum we use for the exposure of the eyeball to retract the eyelids. So eye speculum, and this one is the irrigation aspiration cannula, or we call it Simcoe cannula. So the irrigation aspiration cannula we use in a cataract surgery, especially this part we connect with the drip set where the fluid go into the interior chamber of the eyeball, and this part we use to connect with the disposable syringe. By that we aspirate the fluid from the interior chamber. We have an aspiration hole at the tip of this cannula, the outer or the interior surface of the cannula, which prevent the rupture of the posterior capsule. By this hole we can aspirate, and with the side the fluid go into the interior chamber. So irrigation aspiration cannula or Simcoe cannula, which used in the especially cataract surgery to aspirate lens matter, viscoelastic, even the hyphema or other extra interior chamber material, so you can aspirate with that. Coming to the forceps, we have a larger forceps, and we have the delicated forceps, and this larger one we use for the hard tissue. This forceps is the one where at the tip we have a tooth, so we call it tooth forceps, where this one is a plane, so we call it a plane forceps. So we use this forceps in hard tissue, is like in dacrocystorhinostomy, eyelid, conjunctiva, or tenon. In DCR surgery or the retinal detachment surgery. So this one the harder one, while these are the delicate and sophisticated one. One say that these are the straight and suture tire plain forceps. These are the plain suture tire forceps, especially we use in cataract, keratoplasty, and trabeculectomy to hold the suture and to tie it. One is the same, but there is the tooth at the end of the forceps is called tooth forceps. We use for the corneal holding. So again we use in the keratoplasty, cataract surgery, and trabeculectomy. This one the squint hook, which are the hockey in shape, we use in the strabismus or in the squint surgery, in retinal detachment surgery, to isolate the muscle, to locate and hold the extraocular muscle, squint hook. This one the name of this instrument is dialer. We use to dial the intraocular lens, especially the artificial intraocular lens, so we can dial with that. So the name of this instrument is dialer. The knife holders, so we just have an surgical blade and to put in the holder, so we can hold the surgical blade with this instrument. So this is the knife holder to hold the surgical blade for surgery in cataract surgery or related to any surgery or dacrocystorhinostomy. This one is the wire vectus. The name of this instrument. This instrument is used in the cataract surgery while you extract the lens or cataractus lens from the interior chamber. So you can this instrument at the lip of the wound, just below the or behind the lens, so you can extract by this instrument wire vectors. We have some scissor which are smaller, medium, and larger one. The larger one we use for the Bigger surgeries like dacrocystorhinostomy, eyelid DCR surgery, eyelid surgery, skin, tenon capsule cutting or muscle cutting. So you can use this one. The smaller one, this one is used for corneal scissor, viscous scissor. We use to cut the cornea. So this is the corneal scissor. It is a medium one. The smaller one is by this medium one we can cut the stitches or the suture also. The smaller one we use for the iris cutting, peripheral iridectomy when you do intrabeculectomy. The needle holder, we are two in number needle holder. One is the larger one and the smaller one, and the larger one we use for the using in the skin, eyelid margin, eyelid, and dacrocystorhinostomy. So you can use the larger one, but the smaller one, the a big delicate one, we use in the cataract surgery, trabeculectomy, the keratoplasty, such type of surgery we use the smaller. These are the needle holder. So we hold the needle, and this one instrument is used for different surgeries as I explained. These are the artery forceps to hold the bleeding area to artery, or we use to hold something for the retraction we use to hold the suture. Because there is no such bleeding at all, especially in ophthalmology. The last one is the iris repositor. So we use iris repositor when the iris prolapse. So we reposit the iris to back into its own position. Iris repositor. I hope thankful. I'm very thankful to all of you to listen it and watch it. If you have some problem and you need some addition, so give it in your comments. I will be very thankful to you. Thank you.